So the next one I want to show, a little bit different, a little weird, but we're going to teach your hamstrings how to perform that pelvic tilt, right? So when we talk about lumbar and hip stability, we need the hamstrings to be doing a lot of stabilization of your pelvis to free up your quads and your glutes to do the movements, right? They're your prime movers, specifically with your squats and lunges, okay? So in this position, you can see we're kind of in a pseudo squat, right? We're laying down. So I want to activate the hamstrings to start. So all we're going to do that is dig your heels gently into the box, right? Now, if you don't have a box at home, you can do this with a foam roll, a half foam roll, or even just on the floor or wall. All variations we can go over another time, but hopefully you have something, even a chair should be a good height to try this out at home. So gently dig the hamstrings and then bring your hand on the back of your thigh right here, okay? So the hamstrings attached to the pelvis, which is going to be here. I want you to feel for that muscle belly, right? So stop digging your heels and then dig them again. You should feel something pop into your hand, right? So that's your proximal attachment of your hamstring, the closest part to your hip. We want to envision, and this is definitely a visualizing thing, the proximal end is actually going to draw upwards toward the back of the knee, right? We're used to the hamstring bending your knee or extending the hip. In this case, we want it to pull the pelvis, right? So its attachment is down here. We want it to pull up. So you can visualize if your pelvis was a wheel, when that pulls, if these are blocked and they can't move, the pelvis is going to turn, right? It's going to tuck underneath. It's a strange thing to feel the first time it happens. There is a good chance for those of you at home, if you're not in tune with your hamstrings, that you are going to cramp. It's not a bad thing. It just means take a second, right? Let the cramp go and see if you can maybe generate a little bit less force to avoid the cramp, but right on the edge, okay? The idea is we're teaching your hamstrings how to accept your body weight here, right? Because eventually that pelvic tilt will lead into a bridge, so your butt will leave the table, okay? That's our goal with this. So feeling for that hamstring, gently dig the knee, and then envision the wheel is going to turn. So that flat back position I had you try, start doing that, but see if you can feel it happen via the hamstring pulling up toward the back of the knee. Perfect, yep. So what you're going to see is translation of your femur here upward. Yeah, you can take a break. This is intense. Upward toward the ceiling. What we don't want to see is for the knees to start poking that way, to poke forward. That means your hip flexors are getting involved, and we don't want them to, right? They want to, though. This is what you're trying to retrain your body to use the hamstring instead of the hip flexor for some of this stability. So you're just going to work this as far as you can go, right? I mean, you can tell this is pretty intense. So try to avoid the cramp. If it cramps, it's okay. Just come back down. Now, sometimes I will put a ball or something in between the knees here. She does tend to want to go into a little bit of what we call valgus positioning of her knee, which is sort of an indicator of some weakness in the upper hip, right? So to kind of help her along with that, we can space it out with a yoga block or something like that. A foam roll is fine as well. Anything about 4 to 6, 8 inches, something like that should be fine. And then additionally, to help you find that hamstring, you can put a towel underneath the calf, which we've already done here. It just moves the line of pull up a little bit higher, which is going to target more of that hamstring in the way we want it to anyway, right? So let's keep going. Let's see if we can get you into a bridge. So every time you do it, you're just constantly thinking about pelvic tilt further, okay? This one we do want to go past neutral. It's okay to go past neutral with this. Dig that hamstring, and we're turning that wheel. I want to see pelvic movement here. So try to turn it other way. Yeah, so you're starting to arch a little bit. Yeah. Try to flatten. Yep, and then legs are going to rise up. Up. Yep.
Like up.
Up.
Okay.
Because you're going to come into a bridge, right? So you want your butt to start to leave the table.
Okay.
Yep.
Okay.
But we don't want to see things tip forward, right? Trying to keep them vertical.
Okay.
So let's see if we can flat back. We might not. That's okay. I mean, there's other ways to teach this that we may have to regress to for today. Feel my hand? Mm-hmm. Squish it. Squish it, squish it, squish it, squish it, squish it, rise. Dig your knees or your heels or calves, whatever you have contact there, into the table. Yeah, there it is. Perfect. That's it. Good. And hold that. Right, so now we can see she is smashed into the table. Her legs are nice and vertical. Her butt is beginning to leave the table. Take a rest. Yeah. right? So you can see how weak these are to a degree. I'm sure the pulling strength of your legs is probably good, right? I mean, hamstring curl, hip extend, all that stuff. But when it comes to closed chain activity, so we're talking walking, right? Your hamstrings are not doing everything they're supposed to do. So this leads me into explaining a little bit about impingement of the hip. So with an FAI or a femoral acetabular impingement, without a cam or a pincer lesion, those are not as important for this, but if you're just getting impingement, a lot of times the reason is the ball of your hip joint is sitting too far forward in the joint, okay? It's more of an asymmetry and an imbalance of your strength and when things are firing. So this is going to help approximate or move the joint back, right? So that it sits a little bit further back in your hip. When we do this standing, you're going to feel a big difference in your glutes and how they're firing. But you should start to feel the hip joint will shift a little bit. Again, it's not something to panic over. It's normal. It's what we're looking to have happen actually with this, okay?